Welcome back to Medical Coding with Blue. Today's episode is all about what not to do if you haven't found a job in medical coding yet. If you are brand new to my channel, welcome. I am Blue. I'm a medical coder. Okay, guys. So when it comes to finding your first job in medical coding, it's going to take some time. Okay, that's going to be the reality of the situation. There are very few places that will hire brand new medical coders with no experience. Okay, a lot of these companies and employers don't want to train, and that's just the bottom line of it all. Okay, so because of this, a lot of people get frustrated, especially new coders. They're like, why, can I get a job? And, I just want to work, and, what's up with this? So here's the three things I'm going to talk about today are things that you should avoid if you're running into this frustration, because as I will talk through this episode, you're going to understand, hopefully, what I mean when I say don't do these things, because it's not going to help you. Okay. These three things will not help you. And in the grand scheme of things, you will get a job in medical coding. You just have to be persistent. You just have to be very tenacious when you're going after this goal. And that means that you got to get yourself in line as far as like preparing yourself, as far as making sure that your resume looks good, making sure that your skill set is up to par. These are things that you can control. Okay. Everything else you can't control. You can't control the companies not having time or not wanting to train people. You can't control that. But what you can control is your presentation to these companies. Okay. So here's some things that I want you guys to be aware of that you need to avoid when you're getting into medical coding, because again, you can find your first job. Now, it took me a couple months to find my first job, but the thing is, it was still a long couple of months. When you're working manual labor jobs like housekeeping and bartending and doing all these other things, oh, trust me, it gets to be very tiring very fast. And when you're working 7 days a week, which I was at the time, oh, it's even harder. You really want it. So 2 months can feel like an eternity. So if you think that that wasn't that long, oh, trust me, I felt every bit of those 2 months, okay? And I had no money at the time. So that's something that you all need to understand. You need to quit looking at this, going into this field and finding your first job. You need to quit looking at it like this is the chore part, because it's not. Trust me, you got more chores coming up. This is actually, if you line it up right, you will be able to get where you want to go. Okay, let's just talk about what you should avoid. And here we go. The first thing that you need to avoid is doubling down on credentials. So all you need is one of the 4 main medical coding certifications that employers ask for. The CCS, which is the gold standard of medical coding credentials. This says you have mastered inpatient coding and outpatient coding. And I will say this, if you get the CCS right out of the gate, there is absolutely no reason at all you should be pursuing any other credentials in the first 2 years when you are a brand new medical coder. It is just so stupid. It is so stupid because this one credential says that you've mastered inpatient coding and outpatient coding. The more credentials you add on, the more money you will have to put out. So regardless of having a job or not, regardless of whether you're making money or you're getting CEUs or not, you're going to have to come up with all this extra money. The more credentials that you have. And when you're in your first 2 years, my people, you need to be concentrated on building your knowledge skill and making connections. That should be your priority, not trying to dress up your name. Because somebody who has less than 2 years of experience with a string of credentials, if I'm a hiring manager, I'm not hiring that person. If I see a bunch of extra credentials that mean nothing at the end of the day in this industry, right? Other than the fact that it's growing your name and you're spending more money on CEUs, I don't want this person, because all this is telling me is this person can pass tests, multiple choice tests at that. Okay, so that's my first point on that one. Or you have the CCA. The CCA is perfectly fine. That says you have entry level competence for the outpatient setting and for the inpatient setting. You can apply anywhere with it. And I will always recommend the CCA because I had it for 13 years. Now, a lot of people will say that, the CCA is an apprentice. If you think that, that's ignorance, because that is absolutely not the terminology that is used to describe the CCA. CCA is a Certified Coding Associate. This says that you have entry-level understanding of inpatient coding and outpatient coding, so you can go anywhere. It's ignorant people who think it's an apprentice status that dismiss it. But trust me, this test is very difficult to pass because that test has the most domains of all medical coding certification exams. And what I mean by domains is the unique topics, okay? Because AAPC breaks theirs down by the subject, by the chapter and things like that, and lists it as separate domains. But when you really melt it all down, that's your coding knowledge and skill, okay? So the CCA still has the most unique domains of all the medical coding certifications. So that's something that you have to know right away, okay? But yes, you can have that one. You can have the CCS. You can have the CCSP. That is the Certified Coding Specialist Physician Base. This says that you know all about patient coding. You understand how to use the CPT manual. You know how to code in the outpatient setting. You know how to code evaluation and management. That's what that credential says. So again, if you want to work on the outpatient side, you can still work in a hospital with a CCSP, because hospitals have outpatient clinics in them. I know because I work in a hospital, in an outpatient clinic, and I'm responsible for 2, orthopedics and podiatry. Those are mine. Those are my clinics. No one touches them but me. And I like it that way because they get all of their information from me. All right. But the thing that you have to understand is this. When you are applying, you will hear people say things that are erroneous. Oh, that you, well, the CCSP, oh, I should get the CPC instead. Guys, either one. Employers will look for either one, all right? So that's something that you have to know right out of the gate, okay? CCSP is a fantastic credential. I hold the CCSP and I hold the CCS. Now, before you say anything, I had the CCA first. When I got my CCSP, my CCA was superseded, which means I could no longer carry the CCA. So if you see somebody running around with the CCA, CCS, or CCA, CCSP, that's wrong, okay? And I really wish they would update their credentials on their name because it's wrong, okay? Once you get a higher medical coding certification, the CCSP or the CCS, you have to drop the CCA. And that's just the way that AHIMA has the rules, okay? But with this, right, I have the CCSP and the CCS. When I got the CCSP, of course, that CCA dropped away. And then I decided to get the CCS in the same year because I said, you know what, I have this growing channel and this is going to say that I have the mastery, which I already do. At the time I had 13 years in, you know. But I was like, okay, I got to get this, and I got it, you know. So I carry them both just because it's just like, okay, you know. But I'm talking about my new people. When I see new people get a string of credentials, I'm like, why? You know, you don't have to spend that much money, but you're asking for more expenses the more credentials that you get. You got to pay for the test. You got to pay for the prep manuals. You got to pay for all of these other things that you need. And for what? You're still going to get paid the same as somebody who has one certification. Because if you look in the job listings, they'll say candidate must have CCS, CCA, CCSP, or CPC. And then if they say, well, they ask for CRC as well, what are they saying a lot of times? CRC preferred. Preferred does not mean required. And you know what the CRC covers, the Certified Risk Adjustment Coder? That's all diagnosis coding. Well, guess what you've already been tested on all of 4 main medical coding certification exams? Diagnosis coding. So that's the thing that you have to know right away. But what a lot of people don't understand about risk adjustment coding is that you have to be really good at pathophysiology. And there was a time, not but a few years ago, when I first started the channel, that no one even asked for that credential. You didn't even have to be certified to get a risk adjustment job. I want y'all to think about that. Okay? And then there's the CPC, the Certified Professional Coder. Now, the first 3 that I mentioned, CCS, CCA, CCSP, these are all with the American Health Information Management Association. The CPC is a flagship credential for the American Academy of Professional Coders, or AAPC. Now, this says that you know outpatient coding, okay? If you have less than 2 years of experience or no experience at all, you will carry the apprentice status for 2 years. Now, because AAPC is a business, they have ways for you to accelerate the removal of the apprentice status. You can go through one of their approved programs. You can take Practicode. Practicode will take off 1 year of work time, right? Because Practicode is what AAPC considers what a new coder would do in their very first year of work. Now, some people will turn that around and say, oh, well, that means it's 1 year of work experience. It's an internship. Incorrect. Practicode is an educational tool. Now, there's a lot of different opinions on Practicode, and a lot of people will get upset because they'll say, oh, well, it's too hard. And well, it's 600 real-world redacted cases that have that are not multiple choice, and you have to come up with the answers on your own. So yeah, if you're only used to looking at multiple choice, that becomes a problem, right? This is why I tell you, when you're in school, you need to be covering up those multiple choice answers, and you need to be trying to look answers up on your own, so that way you can start building that skill. Okay. So if you have the, you don't have to take Practicode. You can certainly get a job with the apprentice status. I know, because I write resumes, and I never guarantee my resumes, but I have written for several apprentice status holders for CPC, and they've been able to successfully get jobs with no experience and an apprentice status. Why? Because I was able to convey their skills in a way for a medical coding supervisor or a hiring manager to understand that this is what their skill set is, this is what their skill level is, these are all the transferable skills that are coming over with this candidate. If you are able to do that, you are able to speak to the heart of that hiring manager, and that's how you get their attention. That's how you get their attention. So again, all of these credentials, these 4 credentials say, is that you have all of this knowledge. You have this knowledge and that you're ready. And when you look in the job listings, they're not asking for you to have multiple credentials. They are only asking you to have one. Sorry about that noise. But anyway, so that's the first thing, is don't double up on your credentials. Don't do it. When I see somebody say, well, I have a CCS, should I get a CPC too? Why? You have the Mastery Medical Coding Certification that says that you've mastered inpatient coding and outpatient coding. Why would you go and take a credential exam where you're going to have an apprentice status attached to it until you fulfill the requirements of the removal? Why would you do that? All you need is one certification. And I have never seen a job listing that says candidate must have a CCS and a CPC. If I did, I would run far away from that job, because that's clearly an organization that doesn't understand what these credentials mean. You do not have to have more than one credential in your first year, period. Okay, so that out of the way. The second one, when you're not finding a job as a medical coder, do not apply for patient scheduler. Do not apply for receptionist, medical receptionist. Do not apply for medical secretary. Anything like this, patient access, do not apply for any of those 4 positions, because patient access is a front desk position. Yes, you are checking in the patients. The patients are coming to you. All 4 of these positions are extremely important to the healthcare cycle. Yes, I will not deny that. However, what I will say is this. You have technical skill. You have to get into a job quickly, as quick as you can. I know it's hard, but as quick as you can, using your skills. If you get into a patient access position, I've heard from people who write me crying, saying that they have been in patient access for 4 years and they can't get out. Why did you stop looking for a job in coding then? They feel like they just cannot get themselves out. Don't get there in the first place. Again, apply for jobs even if they're asking for experience. And y'all hear me say this. I know you do. There's plenty of you that will write me later and say, Bleu, I know you said that I should apply, but I don't know. I'm not sure. They're not going to give you an engraved invitation, my darling. They won't. They will not tell you, oh, we really prefer experience, but if you have none, go ahead and apply with us. Because again, employers, if they're hiring, they need somebody now. And they need somebody who understands right now what they're doing. And again, yes, we know you're brand new. You have not had experience before. But if you can display competence, the rest will come along. Especially if you know how to do research, that you are somebody who's semi-self-independent and you can look things up on your own. You know how to do this. You can convey this in an interview. You can demonstrate this when you're doing your test. That's going to look good on you. But it's not going to look good if you're going to sit here and wait, or you're not going to apply as much. Again, avoiding these positions because they're not going to use your skill. And if you say, well, Bleu, I applied for a secretary position and they said that they would let me code for select the codes. If you're selecting codes from a super bill, that's not coding. That's administrative work. And you should never use your skill and not get paid for it. You should always get paid for it. So again, people who try to go in and say, well, I want to do volunteer work as a medical coder. We work in a multi-billion-dollar industry. There's a B on that. Healthcare is a multi-billion-dollar business, okay? When you get everything together, it is a multi-billion-dollar business. They can afford to pay you. You have to keep applying to jobs, whether they're asking for experience or no experience. Look at the job listing. What are they asking for? If it is for a coder, obviously go ahead and apply for it. They can want all day long a person with 16,000 years of experience. Are they going to get it? Probably not. And especially if the employees in that area or those coders in the area are happy. They're not going to move if they're happy, right? So with that said, stick with the jobs that are alternative to medical coding or medical coding. The alternative jobs to medical coding, I've done a whole show on this, right? And I talk about applying for like medical biller. That's the number one that you can get into. And that will help you to utilize your skill, even if you are not selecting codes. It will give you exposure to the codes. It will give you exposure to the electronic health record. If you do not want to get into billing, don't get into billing. Don't get into it then. It's just an option. Now I say it like this because again, every time I do a show like this where I'm trying to help you all, the response that I get is, I don't want to do that. Or as one fellow put it, it's just stupid. Why would I go to medical coding school and go for a billing job? Because reimbursement is part of learning medical coding, and it's just a way for you to get your foot in the door. That's a foot in the door job. You would rather work in patient access? Okay, sir, you go right ahead. You go right ahead. So there's that. Again, trying to help. You can lead a horse to water, but you can't make it drink, okay? But working in something like that in medical billing will help you. Risk adjustment, it'll get you exposure to the electronic health record, but you should really be there for a very short amount of time. I mean like 3 months or 6 months max. And that's just enough for you to start building that skill. Because if you get stuck there in risk adjustment coding, guess what happens? You start losing your skill on CPT. I had a lady who said, Bleu, I've been a risk adjustment coder for 4 years. Can I get a job as an outpatient coder? I said, have you been keeping up on your CPT? Do you know how to code evaluation and management? Do you remember anything about the modifiers? And she's like, no, and no. Well, there's your answer. There's your answer. Get back on those books and study. So that way you can start building your skill again. But like I said, risk adjustment is very good, but in small doses. Again, it will get you exposure to the electronic health record. It will get you exposure to looking and abstracting, like pulling out diagnoses. And that's it. Okay, so again, keep that in mind. You can still continue to apply. You've got your foot in the door somewhere. keep applying. Okay, so that way you don't stay there too long. At least that's just my advice anyway. If you disagree, it's fine, guys. It's fine. I'm just trying to help those who want to be helped, basically. Okay. The other thing that you can apply for is prior authorizations. Now, prior authorizations is not coding, but it will get you exposure to the records, and it will get you exposure to the codes, because the provider will say, I want to perform this procedure on this patient who has this condition. Call the insurance company and see if we can make this happen. Again, is exposing you to the records, and it's getting you that entry-level knowledge. And if you see that the insurance says, oh no, that diagnosis is not supportive of this procedure, and you go back and you talk to the doctor, and the doctor says, oh, okay, well, the patient also has this, this, and this, and then you convey that back, and then the insurance is like, okay, well then that is a valid reason for this procedure to be performed, because the doctor doesn't know sometimes, you know. And so again, now you have that knowledge. Now you have something for your resume that says that you understand what are you looking at in these records, and you understand the pre-authorization process, which is very helpful when you are coding, and it's very helpful for you to understand things about the insurance. Hint, hint. Just saying, because who better to come in with knowledge of the insurance? Who better, right? Because I understand certain things about insurance, but only because I've learned it on my own. Nobody told me. But it does help, because it's just like, okay, well, if there's a denial, okay, well, I know this one's going to get a denial because there's only a certain number of these that can be picked up for this encounter, because they max out at a certain number. You know, okay. So if I know that, then obviously, then the insurance, the biller knows that as well. It's a good thing to know. Okay, so the other thing is you can apply for working for the insurance company themselves. The insurance company themselves are like Blue Cross Blue Shield, for example, right? There's Blue Cross Blue Shield, there's Aetna, you know, all of those, and they need somebody to review the claims. Now, there's a difference in claims reviewer. There's one claims reviewer that's going over to approve procedures. That's not you, okay? The other one is the one that I'm talking about for you, which is the one that will look through and deny claims based on, okay, they're going to run it through an encoder, and the encoder is saying electronic code book, and it's saying that these two codes can't go together, or there's a missing modifier here, or something else is wrong, or there's too many units, or there's not enough documentation, or whatever. You're looking at this stuff and saying, okay, denied or approved. And so again, who better than somebody who is certified? Okay, so claims reviewer. Okay, they have them, they call them different names, but I've seen them mostly called claims reviewer. But that's something that you can look at. You know, look at the health insurance websites and look at their jobs, what they have listed there. So that way, okay, you can apply for those. All right. So that's just something that you can also do. And then the finally thing that I can say about that part, and not pursuing jobs that are not going to use your skill, but to piggyback off these ones that I'm telling you can use your skill and you can build your resume that way, is applying with the temp agency. Now, again, I always get complaints. I don't know why people complain when you try to help them. But here's the thing. I got my first job through a temp agency. Did I think it was such a fantastic idea when I first heard it? Absolutely not. I was like, are you kidding me? But I went with it because I went based on somebody who's already in the industry, who understands the industry. I finally listened, and guess what? They got me a job within a week. Then that job ended after 3 months because it was a temp job. And I didn't get hired on permanently. It's not my fault. I had the skill, but it was the hiring manager or the hiring supervisor herself, whatever, you know. And which is fine, because that led me to my second job, which was for an even longer time. I was supposed to be there for 5 years, and I made it out in 8 months. Because as soon as I got there, I hit the ground running. I learned to do professional fee coding over there. That job, again, was through the temp agency. And they said, okay, you've got this for 5 years for sure. And I'm like, okay, well, this is fine. I can do this. I can just gain my experience and get back home. I wanted to be back home. That was my whole goal, was to get back home to my mom, because my mom was sick and I wanted to be with her. So there I go to my second job through the temp agency. Had I turned my nose up at the first job, I don't even know where I would be. I don't know where I would be or what I would be doing. So I learned everything I could about professional fee coding when I was at my second job. Then I used that. I fleshed out my resume, and I still had less than 1 year of experience. And I applied here to my forever home. And you know what? Having that professional fee was the golden ticket, because I highlighted it, I talked about it, I was very concise with my information on my resume, and that's what got my supervisor's attention. She's like, "So I see you do professional fee coding." I said, "Yes, I do." She said, "Okay." She started asking me a bunch of questions during the interview, and we were on the phone because there was no such thing as Zoom back then. There was no such thing as Zoom back then in, 2009? There was no such thing, right? That anybody was using it anyway. And so I'm on the phone with a 3-person panel, her and 2 other people. Her and 2 other people. And I'm doing this interview blind. Like I can't see them, they can't see me. And in the middle of our conversation, we got disconnected. You want to talk about being scared? I was like, "Oh my gosh, we got disconnected." You know, I had such a terrible connection, or they had a terrible connection. Something happened, but I got a call back, thank goodness. And I was able to complete the interview. And the rest is history. I didn't get picked the first round, but that's okay. When I didn't get picked and I didn't get the call, and it was a very good interview, because they asked me, you know, if you are selected, how soon could you start? I said 2 weeks to the day I get the 2 weeks to the day I get the call. And she said, "Okay." She kind of laughed. Everybody laughed, and that was it. And then when I didn't get a call, you know, of course I'm crying. My mom's saying, "You know what? It's not your time yet. It's not your time yet. Just be patient." And so, sure enough, moms are always right. And I see the job listing come up again. And so I applied again for the position. And sure enough, I got it. And I've been here ever since. 16 years just celebrated. So it'll be 17 this year. So, oh boy. Yeah. But anyway, so that's so you guys know. Had I resisted, which a lot of you are resisting, and that's why you're not getting anywhere, you're resisting. Stop resisting when somebody's giving you good advice, okay? I'm just saying. Apply with a temp agency. You Google in your area temporary agencies for medical professionals, just like I said it. I didn't say medical coder. I said medical professionals, because a lot of times these temp agencies that they're specializing in medical professions, it's not just coders that they're looking for, because sometimes they get those contracts, right? And they need coders. And then sometimes they're just looking for billers. Sometimes they're looking for nurses' assistants. Sometimes they're looking for doctors, or sometimes they're looking for nurses themselves. You know what I mean? So that's what you have to Google. You Google temporary agencies for medical professionals, so that way they can narrow down just those temporary agencies, because otherwise you get like manual labor places, okay? So do that. Apply with them. Yes, I know you need benefits. Yes, I know all of that. But every single job that they put you on is going to be filler for your resume. I'm just saying. And then finally, before I run out of time, the last thing to do when you are not getting a job in medical coding is complain. Do not complain. Do not complain. Do not complain on Facebook. Do not complain on LinkedIn. LinkedIn is the worst place I see brand new people complaining. And anybody who connects with me on LinkedIn and they're brand new and I automatically see them complaining, I block those people on my LinkedIn. No questions asked. Because here's the thing, I don't want to see it, and I don't want to know about it. Because everybody's excuse, of course, is that, oh, you know, it's frustrating. Absolutely, it's frustrating. Does it have to be? Probably not. But if people would actually get more involved with learning, they wouldn't have such a hard time getting in. Okay, that's your ticket to getting in, is your knowledge. They will not hire you if you cannot pass an assessment test. So if you feel like you guessed your way through that exam and you were able to, by some luck, stroke of luck, pass, well, guess what? You better be buckling down on them books again. Get your workbooks. You don't need to buy all these other fancy books. You need to go back through your workbooks and you need to go and study again. And I know that they're allowing electronic books now with AAPC, and that's all fine and well, but there's nothing that's going to beat learning from an actual book. And I will always say that because books are important. And give your eyes a rest, for Pete's sake, okay? We stare at computer screens all day long. And you want to sit there and try to learn from an electronic code book? I don't think so. Learn from a book. Spend time with it. Because that's what's really going to help you. Because not everybody's going to be able to use an encoder when they're at work. I'm just saying. So that's my advice anyway. But that's my take on it anyway, guys. Don't complain. Because if people see you complaining, those are your future coworkers. Because I know that there's quite a few people I've seen complaining that if I ever knew that if I was ever a hiring manager, I would never hire those people. Because if you can't handle a little bit of adversity and get creative and let's fix this problem, if you can't handle that, there's no way you're going to be able to handle the coding. No way. Because trust me, you, again, got a lot more coming up against you. But you have to learn to regulate your emotions as far as, expressing that frustration. You call your mama, you call your daddy, you call your sister, you call your brother, your friend, anybody. You call somebody else. You do not post it online. My advice anyway. With that said, I'm going to wrap this one up. Thank you guys so much for joining me. If this video helped you, please like, subscribe, and share. And I'll see y'all next time. Bye.